When we raised concerns, you ignored us. When we protested, you demeaned and smeared us.
Brought together by tragedy, they say their solidarity has given them huge strength. These families say NHS Greater Glasgow and Clyde must act to protect future patients.
Here we are today, and you must face a reckoning. Do you now have the decency to resign? We doubt it.
The faces of the many child and adult patients whose relatives have spoken to this inquiry. Louise Cunningham's 3-year-old daughter Layla was diagnosed with neuroblastoma in March 2017. During chemotherapy, she endured multiple line infections.
I believe if Layla didn't get that infection on the 8th of January, she would have been longer. It was 8 years there, on the 13th of January we lost her. It wasn't going to save her, but we would have had a lot longer with her. We don't actually know what to think. We actually feel quite numb with it all.
Earlier this week, NHS Greater Glasgow and Clyde said in its closing submission to the inquiry, it is now clear that the Queen Elizabeth University Hospital campus was not ready when it took in its first patients in 2015. Within 3 years of opening, concerns were being raised about the water and ventilation systems following a series of infections and several deaths. They included 10-year-old Millie Main, who died in 2017 after picking up an infection during her treatment for leukaemia. Millie's death and that of another patient, Molly Cuddihy, are among those being separately investigated by prosecutors. In 2021, Molly gave evidence to the inquiry about the infection she suffered during her cancer treatment.
I feel like the building itself is sick. That's where you're supposed to go to be made better.
Molly died last August. Today, her family's lawyer, in their closing submission, said this was in no small part due to the intensive antibiotic treatment.
Molly is no statistic. She is a very real person, and she stood up very bravely and courageously and identified at the time that there was significant challenges with the environment in the hospital. And the saddest part for me is that she's not here today to hear that they've now changed their mind and that they accept there is significant deficiencies which increase the risk to children, including Molly.
While officials had previously denied that bacteria in the water was to blame, lawyers confirmed the NHS board now accepts that infections suffered by some cancer patients were probably caused by the water system. The board has apologised to patients and families affected and says the hospital is now safe.
You know, every parent walk away with PTSD from that ward. Paige was 2 at the time, Caleb was 3 at the time, and our kids only know Mommy and Daddy was fighting with the hospital. I feel heartbroken that we had to go through cancer treatment fighting not just cancer but infection and hospitals and health boards.
We found ourselves in sheer and utter disaster, you know, and instead of looking after our child, we were then left with trying to find out how a hospital was built, things that, you know, we shouldn't have had to have done. And had they've just held their hands up at the beginning, you know, a lot of this could have been avoided.
Families have praised the whistleblowers who repeatedly raised the alarm about the water supply and ventilation with managers. The NHS board's lawyer said organisational failure led to these concerns not being listened to. The added changes have since been made. The inquiry was told that the 3 experienced doctors continue to have concerns about the culture within the NHS board and about the whistleblowing system that they say turned on them and made wholly false allegations about their professionalism that caused lasting damage to their careers.
It is, in my submission, difficult to imagine a worse response to whistleblowers than to produce a list of allegations like this and then to have to withdraw them because no witness will substantiate them.
I think it's going to take some time to process it and really understand what it's done. We've just been in a fight or fight mode for the last 10 years. It's been exhausting, but I don't have a sense of completion. I don't have a sense that we've actually achieved anything yet, and that is still to come.
The final closing submissions will be heard tomorrow. Sharon Frew, STV News, Edinburgh.